Hello, we're going to be discussing today your patients with perfusion disorders, a general risk assessment as well as a physical assessment of these patients. Some of the risk factors for patients with perfusion disorders have control over the risk factors, and other risk factors we have no control over. Some of those that we have no control over are things such as age. As we age, we do have a higher incidence of perfusion disorders. And then males do have a higher risk for all these disorders as well, rather than females. And then some patients, just because of their ethnicity, they're at a higher risk. So certain ethnic groups, such as African Americans, do have a higher risk for perfusion disorders. The next risk of factors are those that we can control. Some of those include our diet, whether or not we smoke. If we lead a sedentary lifestyle, we are at higher risk. And of course, sedentary lifestyles lead to obesity, and it can be just a matter of an extra 10, 20 pounds, or all the way to those that are morbidly obese. So those are some of the risk factors that we can control. When you assess your cardiac patient, what you're going to be looking to do is a basic head-to-toe assessment. So you'll begin at the head. What you'll be doing is looking at their general skin color, whether or not they present with a ruddy complexion, if they're pale, just the general skin assessment. You'll be looking to see if they have an altered level of consciousness. You'll be checking for breath sounds. You'll be checking for heart tones. Breath sounds will be heard in the anterior and the posterior portions of the chest, and the heart tones you'll be listening for in the anterior portion of the chest. We'll also assess pulses. So when we assess pulses, what we're going to be doing is not just seeing if they're there, but we're going to be looking to compare left to right. Is there a difference in what we feel? So make sure that when you're feeling for a radial pulse, that your hands are on both sides of the patient's wrist, and you're looking to see if you feel any difference. So comparing is very important when doing a head-to-toe assessment with your perfusion patients. Next, you're going to be checking for the popliteal pulse and your pedal pulses. And again, on the pedal pulses, you want to make sure and do a comparison. So one hand on each foot, comparing each side. Is one more bounding? Is one present? Is one absent? Just subtle differences, you want to be able to notice those. Also, you'll be looking for edema. So look to see if there's any presence of pitting edema. Pitting edema is anywhere from a 0 to +4 scale. 0, of course, none is present, and a +4 scale is all the way to including pitting edema that lasts 2 minutes or longer. We'll also be looking for what I want to show you today, and that is checking for a carotid bruit. What we're going to do to check for a carotid bruit, we're going to get your stethoscope, and we're going to use a portion of the stethoscope that you may or may not be familiar with using, and that is the bell. Typically, we listen to some heart tones and breath sounds with the diaphragm of the stethoscope. Today, we're going to be using the bell. And the way that you can use that is you're going to put the stethoscope in your ears, and you're going to do what you generally do. You're going to tap on the end of your stethoscope, and you're going to listen. If you can hear that tapping sound on your stethoscope, you're using the diaphragm portion of it. So what you want to do is turn it, check it again, make sure you don't hear that tapping sound. If you don't hear it, what that means is you're ready to utilize the bell section of your stethoscope. So what we're going to be doing is I'm going to have you feel for your carotid pulse, and that is where you're going to be placing your stethoscope. Now when you have the stethoscope in your ears and you have it placed on the carotid, what you're going to hear is your typical lub-dub, lub-dub, lub-dub that you hear from heart tones. What you would hear if you heard a bruit is a whooshing sound. It would sound like a whoosh, whoosh, whoosh sound. So that's what you're going to be checking for, either that lub-dub, or the presence of that whooshing sound. The whooshing sound indicates that there is stenosis in that blood vessel. So that's why it's important that we check for that. What you're going to be doing is you're going to just put your stethoscope in your ear. You're going to make sure that you don't hear it on the diaphragm portion of your stethoscope, meaning that we're going to be using the bell. You're going to feel for your carotid pulse. Place the stethoscope right over that. Now, it's really important because you're probably going to have a talkative patient. They're all, interested in having nursing students, and so make sure that you have them hold their breath, because if you don't have them hold their breath during this portion of your assessment, all you hear is either the breathing, which will be very loud because we're up so close to the trachea, or you hear them talking. So what you'll do is, once you're in place, just have them hold their breath and listen for a minute. So hold their breath. Just take a listen. What you should hear for is that either lub-dub, or that whooshing sound. The whooshing sound would be positive, meaning that there is a bruit present. So those are the assessment skills that we need for our patients with the perfusion disorders, and how to check for a carotid bruit.